And Minister, just before I get into the long COVID itself, I'd like to call upon the Government to launch a full independent review into the handling of COVID. We need answers to things like what happened in our nursing homes in 2020, how our ICUs across the country were under-resourced and what improvements have we seen as a result, why the HSE lacked capacity despite all of the billions pumped into it, how the Government, the state broadcaster and many other national media outlets performed and what lessons have been learnt. And finally, can the Government introduce a restrictive covenant period in employment contracts to ensure former high-ranking HSE officials are unable to take up employment with companies that have been subject to or awarded contracts during their tenure in the HSE? And I hope Government will consider this as part of restoring confidence and ensuring transparency for the people of Ireland in its health service. So moving on, the COVID response has raised a lot of questions, and there is no denying that COVID-19 has had a more significant and ongoing impact on some people more than others. And I'm sure we've all heard of cases from friends, family or constituents where COVID-19 has emerged as a major ongoing problem, sometimes for weeks and months after the COVID initial infection. So this long COVID is presenting itself in a variety of forms with a variety of symptoms. The ability of some people to return to work has been compromised or limited by a continuation of COVID symptoms, most commonly fatigue and ongoing breathing difficulties. And using the figures that were available to us in putting this COVID motion together, the inability to return to work or return fully to work may be affecting as many as 21,000 people. Now, obviously, we hope it won't be as high as that, but we do need to have dedicated resources in our health system to help as many of those people back to their vibrant selves as possible. The motion is calling for the Government to do many things, and one of them is to get to grips with staffing levels. Pay in terms and conditions across the areas of the health service where recruitment is an ongoing problem must be improved. We have heard promises of waiting lists being abolished and services being improved, but this can only be done if we have the people to do it. There are currently no specific services for children with long COVID, and as we know and recognise in other areas, children often need differentiated care for a variety of illnesses than adults. Children are obviously in a very important developmental stage physically, emotionally and socially. That's why long COVID may have more devastating and lasting effects on those who get it at an early age. The motion calls upon the Government to establish a dedicated and specialist-led long COVID clinic for children who are without a dedicated centre presently. A dedicated team working solely on long COVID in children may be able to bring about better recovery and better outcomes, in particular the prevention of lasting mental health problems or stigma in later life. For those of all ages currently suffering with long COVID, this motion is also calling upon the Government to develop an innovative rehabilitative and recovery programme that's designed to meet the needs of those experiencing long COVID conditions and other post-viral chronic conditions to ensure that they can make a full return to a full and active life as possible. I'd like to remind the Government that in December 2020, the Government published a report reviewing the law of torts and current systems for the management of clinical negligence claims, led by Mr Justice Meehan. And it stated in its expert report that it accepts that there is a strong moral argument for the state which actively encourages vaccination, and they should accept responsibility for those who suffer harm as a result. The report recommended that a vaccination compensation scheme be established as a matter of urgency, and I hope that the Government will acknowledge the findings of this report and introduce the scheme without further delay. In conclusion, Las Ceann, if those experiencing long COVID can get the help and support they need as soon as possible, then outcomes will be better. This is the same for any illness. The earlier it is treated, the better their chances are. The better personal, social and economic outlooks as a whole will be the result. And our hope is that the entire House, and I conclude that the Government aren't opposing this motion, so in evidence they're accepting it. And I thank my colleagues also, particularly that of Dennis and Caught, for putting this motion together. Thank you. Together.